Hi, I'm Dan Kendall. I'm the host of the Digital Health Today program and the founder of the Health Podcast Network. I'm here at the Barcelona Health Hub, and with me today is Cristina Bescos. Cristina is with EIT Health. Cristina, thanks very much for joining me.
Thank you. Good morning.
Cristina, let's start off with just a little bit of background information. What is your role? And tell us a little bit about the EIT Health organization. I think some of our audience might not be familiar with that.
Yeah. So my current role, I'm the managing director of EIT Health Spain, which means that I represent the Spanish Association of EIT Health. EIT Health is a broader association covering the whole of Europe and really facilitating innovation in healthcare. And this is an association of more than 160 partners from industry, academia, technology institutes, public sector, all working together to promote and really bring in innovation to the market. So what we have seen in Europe, we do very good research, but we are lagging behind other geographies in bringing those, good solutions to the market, and that's our role in EIT Health.
Excellent. So you said about 160 organizations
Yes.
across all of Europe.
Mm-hmm.
You've been based here in Spain. You're in the role for almost a year now. I think
Exactly.
you're coming up on a year in your current position. So what are some of the things tangibly that you're working on to try to address that need, the fact that we're behind a little bit on the research generally in Europe?
So our role is really to bring the key stakeholders together and to work together in collaborations. And we have three lines of work. One is education, and it's really helping not only students to learn innovation, but really to support the current professionals and executives to do things differently, adopting not only digital skills, but new ways of working. That's the area of education. There's a program for innovation, which are collaborative projects in order to bring this innovation faster to the market. And we have another branch that is acceleration, is really supporting startups and entrepreneurs in their pathway. And we are supporting from very early phase to the whole setup in maturity, even trying to combine in collaborations with the European investment funds in being able to really raise large amounts of funding for the startups.
The second thing you mentioned there was around trying to bring innovations to market.
Yes.
And that's something that I've spent my whole career really focused on.
Yeah.
And it's one of the big frustrations that I have with healthcare in general. It's very difficult to find the pathway to actually get the products utilized. So talking about Spain specifically, maybe you can speak to Europe more broadly. What are some of the real things that you're doing to try to make that a reality, where these new inventions can actually get to the point of care or use in the healthcare environment?
Yeah, we did a think tank last year all around Europe about this area of the innovation funnel. Why it is so complicated to bring things to the market is because of regulatory, is because of the culture. In the end, it's a mixture of many things. But we've seen specifically for the area of Spain is we have a public system that is in general working very well, and we are very happy for it. But there's a question about the sustainability in the future if it doesn't adapt to the new demands. No, what is happening in Spain? There's very good link between the clinical and the technology part, but we have clear gaps between the technology component, how to bring that earlier, and what is the investment part and the adoption from the public system. So investments or private investment comes too late normally in the journey compared to other geographies, and especially the adoption processes by the public system, it's very slow, very complicated, and it's difficult to manage. So there are some examples now of innovative procurements that are coming up in specific regions that are leading, but you see in the general terms is really the phase that Spain is really not progressing as we should.
You also mentioned working with startups to help them on their journey. So what are the resources, programs that are available for early stage businesses? Does it include money? Does it include grants? Is it mentorship? What are some of the things available?
We provide all different types of services, and we have also asked the startups what the value they see in us as EIT Health for them, and one of course is money, but our maximum grants for startups is 50,000 euros per year, so it's not really a big amount of money, but what we can really give them is access to peers, to other collaborations among startups, to mentors and coach programs. And specifically, what they really appreciate most is the access to the network, to corporates and venture capital, private investors, and public stakeholders, so that they can really have these conversations early enough in the process.
So for all the audience, whether they're providers, whether they're with big corporations, whether they're startups, or perhaps just pursuing their education, what are some of the key things that you'd like for people to know, and where should they go for more information about what EIT Health does?
I mean, I think what is unique in us is that we are not just a funding mechanism, as you know, is that we really provide this accompanying mechanism, so that we really support and we are following the journey with the entrepreneurs, so that we really select and personalize our support. And we have a variety of programs, and we really can guide which one is the best for the moment of maturity of the solution and the team. No? So what I would recommend is definitely to contact us in the case of Spain, so to our office. In the other countries, there's always a representative of EIT Health, and really make the connection, and we will guide you how to enter into the network, because I think it's very important that we really put that in the service to the entrepreneurs.
And people can find that by going to eithealth.com?
.eu.
EIThealth.eu.
Exactly.
Excellent.
Yeah.
Very good. Well, thank you very much for taking time with me here in the Barcelona Health Hub studio. Wish you a lot of luck for the year ahead.
Thank you.
Thank you.